There are a few reasons why a woman or a couple would not want to consent to having their baby through a cesarean section. Either it be a planned cesarean section or an emergency cesarean section. Poverty, religious beliefs, traditional and cultural beliefs, and the thoughts of dying from a cesarean section while giving birth are very, very common reasons why a couple, a woman, would decline signing an informed consent to having their baby through a cesarean section, and they would rather want to pursue the more, at that point in time, risky vaginal routes of delivery. They are not to be blamed, they only need to be educated, because no woman would want to die from having a cesarean section. No man would be happy to lose his wife giving birth through a cesarean section. And no doctor is happy to break the news of the demise of a woman to her relatives that he took in for a cesarean section in an attempt to save the life of the mother and the life of the baby as well. Essentially, no woman should die giving birth, because the goal of standard obstetric practice, from conceiving to antenatal care to the delivery and the immediate postpartum period for the woman and the baby, is to have the woman alive and well, irrespective of the route of delivery. Death is very scary, especially as a complication of surgery, in this case, cesarean section. So in this video today, I'm going to be sharing with us 11 possible complications that could arise from having a cesarean section done on a woman to deliver her of her baby. If you are new to my channel, I want you to please subscribe and turn on your notification bell so that you don't miss out on my videos as I upload them, and also so that you can easily come back to watch already uploaded videos. I would also want you to like this video, share with your loved ones, and watch to the end. Number one very common complication or possible complication of cesarean section is pain, operative site pain. In cesarean section, a surgical incision is made on the skin and it is developed down through layers until it gets to the uterus, inside the uterus where the baby is to be delivered. And once this is achieved, there is a repair of every layer that had been breached. Because this is necessarily a wound or an injury to the body, it is expected that there will be pain. However, as common as this complication is, it lies on the part of the doctor to make sure that his patient is almost pain-free following a cesarean section. So there are medications that the doctor would have to institute or would have to administer in the post-operative period after a cesarean section. The second possible complication of having a cesarean section is infection at the site of surgery. But with the proper administration of antibiotics, the risk of infection to the surgical site becomes very, very minimized. The third possible and deadly complication is bleeding following a cesarean section, what we call postpartum hemorrhage. Postpartum hemorrhage in cesarean section is when a woman loses more than 1 liter of blood, that is more than 1,000 mils of blood following a cesarean section in the post-operative period. But the doctor would ensure that he's going to take care of every factor or every risk that expose this woman to having a postpartum hemorrhage after a cesarean section. Another common side effect or complication of having a cesarean section is a prolonged hospital stay or a longer stay on admission as compared to vaginal delivery. When nothing goes wrong and everything goes smoothly, following a vaginal delivery, the woman will be on admission on an average of 24 hours, from a few hours to 24 hours or maximum 48 hours. But following a cesarean section, the woman would necessarily have to be on admission for about 48 to 72 hours or more, depending on a number of other factors that she presents with. So essentially, a woman that is delivered of a baby through a cesarean section will usually stay longer on admission than a woman who delivers through the vaginal routes. Another complication that may follow a cesarean section is what we call the pelvic wall adhesion. This is the uterus and other neighboring organs gumming together, adhering to each other. So we may have the intestines adhering to the uterus or the bladder adhering to the uterus. The neighbors of the womb adhering to one another. And this usually is a complication that happens much later. Another common complication that we see with cesarean section has to do with side effects of the anesthetic drugs that the woman was administered with. Rigor, for example, is a very common side effect of the anesthetic medications that we use in surgery. For women that would have spinal anesthesia for their cesarean section, which is what is very commonly administered now, there is the risk of having headaches following a spinal anesthesia, what is commonly called a spinal headache. These are very, very common complications. Another complication that may arise is what we call incidental injuries to the neighboring organs, the surrounding organs of the uterus. But this is very, very rare. This is a very, very rare complications, in which case there may be an incidental injury to the bladder, there may be an incidental injury to the intestines. But like I said, these are very, very rare complications. The experience and the skill of the obstetrician would usually make him ensure that as much as it lies on him, he prevents these complications. Another possible complication or side effect of undergoing a cesarean section, which again is also very rare, is the formation of blood clots in the deep veins of the body, what we call the deep vein thrombosis. As an extension, there could be what we call pulmonary embolism, that is a clot traveling from a distant vein to the lungs, which may cause respiratory distress. And this is usually more common in women that are obese. But for a woman that is obese, the obstetrician will also make sure that the things that should be put in place to reduce our risk of coming down with a deep vein thrombosis or a pulmonary embolism is usually instituted by way of medications or some other medical methods. Another common undesired effect or complication is the probability of having subsequent pregnancies being delivered by a cesarean section. After a first cesarean section in Africa, a woman is usually given the opportunity to try to go through vaginal delivery, that is labor, after a first cesarean section, especially if whatever was the factor or the risk that made her have a cesarean section initially is no longer there in the index pregnancy. She's usually allowed to try to go through the process of vaginal delivery. But if during the process of labor there is a risk that arises that will put her life at risk or the life of the baby at risk, then she would have to go through another cesarean section. So, as it were, a previous cesarean section or one cesarean section is usually a risk factor for subsequent pregnancies to be delivered via another cesarean section. Another common complication for the woman is emotional imbalance, psychological instability in the immediate postpartum period, in the immediate period of delivery through a cesarean section. This would usually also happen after vaginal delivery, but it is commoner after a cesarean section. However, it will just take a matter of days, and with the support of family, with the support of the husband, and with the counsel of the obstetrician, she would usually come out of this in no time. The last complication is what we started with: death, the fear of dying from a cesarean section. There are a number of times that a woman goes in for a cesarean section and eventually she dies. This would usually arise from postpartum hemorrhage, from whatever the cause may be. Sometimes it could be from side effects, very severe side effects of anesthesia that I did not previously mention. It could also be from blood clots formation in the body. This is usually dreaded. But in centers where we have standard obstetric care, the woman would have been assessed during antenatal. Every hands will be on deck. No stone will be left unturned, so that as much as possible, she does not die following a cesarean section. Like I said, and I would usually say, the goal of standard obstetric practice is to have a mother and a baby alive and well at the end of pregnancy. Every doctor would make sure that as he goes into the theater with this woman, he comes out with the woman alive and well, and also with her baby. Doctors are not in a rush to do a cesarean section, but when the vaginal route of delivery is considered to be risky for the baby and or the mother, and it is clinically considered that cesarean section would be a preferred route of delivery, then he would advise, he would counsel the woman or the couple that the best route of delivery for her index pregnancy will be through a cesarean section. What we want again is that at the end of the day, the mother and her child are alive and well. If you've not subscribed to my channel, I would encourage you to please subscribe, and again turn on your notification bell so that as I upload my subsequent videos, you will not miss out on them. See you in the next.